In this episode, we are exploring the impact of drugs and alcohol on your sex life. Welcome back to The Naked Connection. This is the show that supports driven men to reach sexual mastery and build deep connections. It's your girl, Kirsten, and I want you to take a moment and hit that subscribe button so that you don't miss a single episode. Look, you guys, so many people like to kick off the new year with a dry January. And so I figured, why not explore a little bit more deeply about what is unfolding in your sex and in your love life when it comes to substances like alcohol or marijuana, cocaine, MDMA, meth, you name it. Now, maybe you're wondering to yourself, how does that weed gummy before sex influence my performance? Or maybe how does that extra shot of Jack Daniels shift my ability to connect more deeply and openly with my girl? Or maybe you're wondering, how does having sex on drugs like cocaine or MDMA change my overall sex life? We are about to explore all of this and so much more. To have this conversation, I invited Dr. Jenniferkonzen onto the show. Dr. Jennifer is a licensed sex therapist and also a chemical dependency counselor. She is a researcher and a renowned professor who has studied and published on the dynamics of substances, shame, and sex. I cannot wait for you to meet her. You guys, let's get some. Dr. Jennifer Konzen, welcome to The Naked Connection. So honored to have you here today.
It's great to be here. Thanks for asking me.
In understanding that you are both a sex therapist and also a chemical dependency counselor, I'm really excited to talk to you about substances, addiction, and how that really influences relationships today. So in understanding all of the work that you've done, I'm really curious to see, what have you noticed have been some of the biggest impacts of substances on a couple's intimacy, on their sex life?
Yeah, it comes up quite a bit in the work that I do. Sometimes the impact is connected to problematic substance use. So this would be where someone qualifies for say like a DSM diagnosis of addiction. And so that would be with substances specifically where they are using alcohol or marijuana or some meth or heroin, and they're using it not regularly or occasionally, but they would fall under moderate to severe use disorder. So when someone comes in to see me, if they fall under moderate or severe substance use of some kind, it's absolutely going to have an impact on their relationship overall and on their sexuality. On the relationship, the biggest piece that comes up is the loss of trust, because there's a lot of deceit involved in high levels of use where people are hiding. They're trying to change and they keep going back to it, and then they hide when they go back to it. And so there's lots of feelings of betrayal, and it's male or female. Sometimes it's the female partner that's using. But the more common thing for women will tend to be alcohol and marijuana, though all the other substances can be problematic as well. For men, definitely those two as well, but you're going to have some of the harder substances a bit more common. So all of them have an impact on the relationship overall. The trust, the betrayal, what you call traumatic bonding, where especially with alcohol and marijuana, that only when that partner is under the influence of that substance, then they're able to fully share and be open and have intimacy emotionally. Like they're too guarded, or they don't share emotions, but now they're smoking and out comes all the things they feel. So this feeling comes up a bit in the couples I work with. The only time you really talk and share and are open is when you're under the influence. So those kinds of impacts are some of them. When it comes to sexuality, there's quite a number of things. Couples will sometimes use alcohol to relax, and we have a better time sexually if we are smoking some weed. And the thing is that women specifically will use these substances because alcohol and weed they lower inhibitions. They do. But it also means that women especially, men will too, but women especially will use those substances. They don't want to have sex, so they'll smoke or they'll drink in order to be able to engage. That has long-term damage, not initially because, hey, it's fun and I'm having fun. But then, gosh, couple after couple, where I had a husband who was saying, I don't see what's wrong with that. I mean, she's at least willing when she smokes or takes a gummy. But she started feeling, wait a minute, the only time I'm having sex is when I'm like forcing myself to by taking this substance. Mm. And that doesn't always show up at first, but over the length of time of a relationship, this piece of the only time we're emotionally connected or the only time we're engaging in sex is under the influence. Those are the lighter ones. Those are alcohol and marijuana, right? Which I say lighter in the sense of they're more common in use. They're not as immediately destructive as meth and heroin and cocaine, but it has a significant impact on the why they engage in sex. And then all of them affect functioning. So alcohol, people will drink alcohol, but then it causes problems with reaching orgasm. People will actually use cocaine and heroin and meth because it increases erectile functioning initially. It's got some similar properties to like Viagra. So it will initially increase erectile functioning, but then it's hard to reach orgasm. And so people who have used multiple times can actually do some damage, sometimes permanently, sometimes when they stop using, their functioning returns. Alcohol does the same thing. It makes reaching orgasm take longer. And so some of the substances can cause temporary problems to functioning for both men and women, but then sometimes they can cause permanent functioning. Then the way they combine can be things like somebody who has a cocaine background where they had ecstatic orgasms, because that's one of the experiences people have. When I was using cocaine, I had an orgasm. It was like out of this world. So then when they're sober, their sexual relationship isn't as ecstatic because it was all influenced by the drugs. And then they're not as feeling as fulfilled because they've got this dream and this experience. So then they relapse back to cocaine. So one of the pieces that comes up is sometimes the drug use or the sobriety from drug use causes problems with sexuality, and the problems with sexuality cause the relapse. Mm. Or if they have and this is very common with my couples and the individuals that come and see me, they do both drugs and sexual addiction. So they're doing pornography and other forms of sexual addiction, either strip clubs or massage parlors or prostitutes or just all stuff online. And that they've been trying to get out of that. They feel a lot of shame about that. But then they're also doing all these different either illegal substances or legal substances. And so when they go sober from one, they relapse on the other, or they go sober on that one and they relapse in another, or they double relapse. Oh. So my clients, I had one with meth and sexual addiction. And when he would relapse, he would use meth and then do all the sexual addiction. Or he'd do the opposite. He'd end up doing sexual addiction stuff and then relapse on meth. Yeah. So they overlap actually quite a bit as far as both sometimes people use drugs to help because they think it helps their sexual functioning. Yeah. Then it has problems. So they overlap quite a bit.
Yeah. Yeah. It's sounding kind of like in some ways a little chicken before the egg dynamic of what's causing what here. And it's interesting that initially a substance can provide and improve sexual experience or performance. Efficient. Yeah. And it's almost, I think we can grasp hold of that initial and then chase it despite the prolonged
negatives, negatives. Yes.
I'm wondering, I think a lot of people have this question of, do I have a problem? Is this something that I'm struggling with? How, this is such a social culture of drinking and drugs are becoming more legalized. So like, how can someone answer that question for themselves?
Such an important question. So when you look at, again, this kind of comes down to what's an addiction? Does someone have an addiction or not? It's not always the most helpful way to look at it. Do I have a problem or not? If someone is asking that question, they probably already fall on somewhere on the spectrum, meaning something's bothering them about their use. I had a gentleman come in who'd been drinking a glass of wine once a week and then started realizing he was drinking once a night, just a glass of wine or a beer. And then he was doing 2 a night. Like it just did this slow slide. And he was like, am I an alcoholic? Right? Which isn't really the helpful question because not falling on the streets. He's not using meth and losing his job, right? He's using occasionally, but he's starting to realize I'm using to help myself emotionally. I'm using it to get stuff done. I do meth every now and then just to be more protective. I'm using alcohol every now and then just to be more socially, having fun. But then it creeps into where I'm using it when I'm stressed. I'm using it when I'm down. The stress piece, the amount of individuals that use a substance of some kind to relax. Like it sounds so mild. I'm just trying to relax.
Yeah.
So when they're using, and it can be a behavioral addiction like gambling or pornography, or it can be a substance addiction like alcohol or meth. When someone's using it to de-stress, to lower their anxiety, whether they're in a partnered relationship or not, even in partnered relationships, I'm super tense, so I have to have sex with my spouse in order to lower my anxiety. Or spouses will say, I better give in because she or he is a grump if we don't have sex. So that's when someone's using sex actually for an emotional reason to lower anxiety, which is after a while, even after just a little while, going to cause problems in the relationship. Partner feels used. You only want to have sex with me when it's not to be with me. It's, you have a need. So that idea of using drugs or any kind of addiction to lower anxiety becomes where it's crossing that line into problematic use, right? Now, definitely once someone is in the category of it caused them to have hangovers once a week. It's causing liver issues, or they keep trying to quit and they can't stop. They keep going back to the substance and can't, even though they keep saying, or they go to an event, I'm only going to have 1 glass of whatever, and they don't remember the rest of the evening, and they keep doing that. They have people in their lives saying you have a problem. Those are the markers of an absolute, okay, I've lost someone who obviously has lost their job. They've had multiple DUIs or just a DUI. Those are all the signs of somebody at more of the moderate to severe. Like it's not the individual who's drinking 2 a night to calm their nerves, which is already problematic at that level. But it is more severe because now it's affecting their relationships and their job and their function. So that's your higher end of use. So I would say if someone's asking that question of, do I have a problem? The input, and I get asked this a bit, actually, I respond with, what would it be like if you try out for 30 days, 90 days, 6 months? I usually say more like 6 months, not using. And what do you start noticing? Because it takes about that long for the substances to get out of your system, to get your head above water so that you can realize what impact do they have. So even if it's 2 a night, or if you've got more severe issues, do a period, month. I'm saying 30 days because possible, but it's really not long enough. More like around 6 months. Stop for a while and see what happens. And what do you start noticing? And what most people can't figure out why they use till they're out of it for a while. What's the purpose?
Yeah. Yeah. And it's sounding like in part looking at by either like using a substance or even engaging in sex, is it to shift an emotional experience? Or is it kind of being used outside of its intended use? It's like instead of engaging in sex to connect with someone, to have a sexual experience, I'm going to have sex to feel less anxiety.
And they won't always say that. They will never say it that way. One husband that I worked with, and this happens regularly, where they'll say, oh my gosh, it's like the best feeling ever. So I just want to have sex all the time. And oh no, I'm not stressed at all. I know I worked like a fiend, but no, I don't have any anxiety. This was so sometimes what happens is sex becomes so often, like this individual was having sex with their partner almost daily, definitely multiple times during the week, but then also masturbating multiple times, sometimes a day, 1 or 2 times a day, or at least multiple times a week. And that's when you go, you're using sexual release, orgasmic release, because it does flood your body with oxytocin, dopamine. So oxytocin is the cuddle hormone. It lowers cortisol and adrenaline in the body. So it actually does. Orgasmic release does lower all the stress hormones. And so if this individual is, he's having an orgasmic release a couple times a day, at least daily, and he's, I'm not stressed at all. Then I said, it's possible, that you're actually, because you're taking your pill every day. Mm-hmm. You're taking your pill every day. You're using sex because it does flood the body with those hormones. And so, of course, then you end up with a partner who's, I'm not having sex with you anymore. And it'll, destroy a relationship or really cause significant problems in a relationship. And so, yes, that's important to pay attention to.
Yeah.
Why?
Yeah, why? Yeah, and I'm wondering if someone's listening to this and they're noticing, wow, I haven't thought about it before, but, 9 times out of 10, when my wife and I have sex or my girlfriend and I are together, she's using a substance or we're always drinking before we have sex, or we're always getting high before we have sex.
Yep.
What is the first step of either like addressing that with their partner or shifting out of it?
Well, to tell you the truth, I think that would be a great question for someone to ask. However, some of the times with the men that I've worked with, they almost feel like at least it helps her want to, because they're really wanting to have sex and they're not realizing the damage that's happening that they're involved in. So there's that. Like, number one, that's a really good and important question. If your partner is using a substance in order to engage, I call it the bypass, or I use different words for how it skims over why they don't want to. Mm-hmm. And so they're using a substance to do it. Now, sometimes people will say, because it increases my enjoyment. But what is it that's keeping you from enjoying such a wonderful thing? Sex is a wonderful thing, and it's very physically enjoyable. It's very partner connecting. So is their partner, without the substance, are there reasons that they're not feeling drawn to having sex? Do they have a low interest because they actually haven't worked through maybe trauma in their background, or they have their own anxiety, lack of, dealing with their own mental health issues? So a female partner might go ahead and use a substance in order to engage for any number of reasons. And sometimes it's to lower their inhibitions, because it does, and most of them do. In other words, they have all kinds of inhibitions they've never worked through. So they're using the substance to kind of override that instead of working through the issues. Sometimes that female partner is using the substance because maybe they have physical pain, like literally intercourse is painful, and it helps them just kind of keep going despite the pain. And then they're never dealing with the painful issue. Or they themselves don't really want to have sex and they're only doing it out of obligation. But if they take the substance, it'll help them at least have some enjoyment. So then they're not dealing with the belief system that's got them at this place where they're doing it out of obligation. Or it's not letting them have a chance to explore the fact that maybe they're not having orgasms themselves. They're not enjoying sex. They'd rather avoid it. And so their own enjoyment level, which is pretty common for women, where they will go ahead and have sex because they have to in their minds. Mm-hmm. So maybe the partner is giving that message too, but because of their upbringing, they're having sex because they're supposed to, that obligation duty sex. And that's often tied with because they're not actually enjoying sex. They're not having orgasms. Mm-hmm. And so substances override all those issues often. They just kind of cover over them And I've worked with couples with then when they decide not to use the substance anymore, out comes all of those pieces that really do need to be dealt with.
Yeah. Yeah. Because from what I understand, it seems like in a lot of instances, substances can be this really temporary coping mechanism to manage something that's painful or hard or difficult. And it works for a moment.
Rarely.
Yeah. But then it becomes in the long run, what you're describing, kind of a maladaptive coping strategy to cover up or bypass what's really going on. When someone reaches that point, maybe where they've decided to stop engaging in a substance or a behavior, and maybe they're even in a place of recovery. This is something that has come up just in knowing people in my personal life and working with people that are, out dating, and maybe they meet someone who is in recovery, or they have a partner who is in recovery, of like how to even manage or explore that with somebody.
Kirsten, I wrote a book on it.
Oh, okay.
So I don't even know if you know about this one. So I wrote a book called The Ransomed Journey, and it's couples recovery from addiction.
Interesting.
And because addiction of whatever kind, whether it's substance or behavioral, if somebody's in a partnered relationship, it impacts both of them. Most of treatment models are focused on individuals. They decide they want to go sober, they want to go into recovery, whatever that means. And they go to support groups, and they go to a therapist, and they go to, read. And most things are focused on them individually. It's really a bit challenging to find support for the couple because it does affect the couple. Either, and this has happened where one of them decides to no longer drink and the other one wants to drink, and it becomes this issue of conflict between them. How do we deal with that when you're bothered by my drinking, but I'm not bothered by my drinking? Or if it's some other substance. Most of the time, partners, though, do want to be supportive because they've seen maybe the damage it's done, or they just want to be supportive to someone they're dating or someone that they're in a relationship with, but they don't know how to. And so sometimes partners can over function where they're like, did you go to your support group? Have you talked to your sponsor? And so there's that. I think the biggest thing that happens for especially new relationships is they don't know how to talk about it. And it's actually, I think early on, it might not be the first conversation someone has either on a date or even in the early part of a relationship, but the lack of talking openly. Okay, we talk about how the lack of talking openly about sexuality causes problems, which is huge. But it's the same thing about substance use. The lack of talking openly about it is problematic. If people have been in relationships longer term and someone's in recovery, number one, I tell them to get a good program. They need to get in a good program. They need to have a sponsor, have a process they're following, like either a 12-step or a smart recovery or a book written by a specialist. But then also the couple needs to do things. The partner needs to learn, are they doing anything that is either non-supportive or problematic or actually encouraging the use in some way? I'll call your boss and say you're going to be late today when actually they were hungover. So what we call enabling behaviors, like how does a partner not enable? But again, that piece about talking about that openly, I tell people, first of all, go get that book and read it together. There are a few, not very many, books for couples on recovery. Also, you can go on, most people who know much about therapy and couples work would know the work of John Gottman. If you go on the Gottman website, there is a deck of communication cards. They're called the Recovery Cards by Robert Navarra. So Gottman's website, Gotman, and the cards are by Robert Navarra, Navara. And they're communication cards around the process of recovery. What a great idea. So getting people to talk more openly and real. So I go through in the ransom journey, I have communication exercises at the end of every chapter to help couples begin to talk.
Wow. Yeah, and I'll put all of that in our show notes. Yeah, it's really interesting in doing some of my clinical hours at a rehab of just witnessing individuals for the first time really talk about their substance use struggles with other people. It's like the first time they're vocalizing this and then recognizing, oh, wait, I have this partner that I love and we have so much rebuilding to do and we never have addressed our dynamic. What's unfolding here? What's happening with this? And this is one thing that I felt so naive about. And, I know people go to AA meetings and things like that. I had no idea. I just thought in my mind, oh, it's something you go to like once a week, maybe. And coming to uncover that many people go almost every day to meetings like this it's like a whole commitment, a new way of life in a lot of ways. And bringing your relationship, your family with you in that space can, I imagine, be really challenging.
When people are first, especially in early recovery, needing to just get through the urges to use, because the urges can be so strong in early recovery, they need as much support as possible. There's a commitment to things that what they call a 90-90. 90, exactly like what you're saying, 90 groups in 90 days, doing a group a day, doing this a day is important. And just it's challenging. So early sobriety, relapse is high the first year. And so early sobriety is 1 to 3 years, middle is 3 to 5, long-term is 5+. In other words, they deserve the support over a long period in order to bring about change. And most of the times, I don't know if your audience is religious in the aspect or a mixture. Most of the time, people who are religious, they'll go, I talk to the guys at church. That's not enough. You need a support group of people who really get it.
Yeah.
Whether people are religious or not. So say a 12-step program tends to talk about the higher power. Smart recovery doesn't refer as much to religious beliefs. It doesn't, like whatever group someone goes to, they, especially throughout their life and then higher percentage of their time put towards recovery early on because of the level of relapse and the urge to use is so high early on.
Yeah. Yeah. And it's so interesting. I had, at the rehab I work at, there was a patient who basically had written a letter to his substances that he liked to use. And it was kind of like this breakup letter because he was like, I was in love with this drug. And we had good times together. We had bad times together. And now I'm choosing to never return to her again, is how he kind of talked about it. And
I'm mourning.
Yes. Yeah. And there was this grief and this sadness. And in recognizing that could be unfolding in a relationship, it's almost not an affair, but like you have
it's like
this
an
third
affair.
thing that's there. Yeah. Yeah.
Actually, people literally say it's your mistress. Oh yeah. No, it's very much like an affair, like a relationship. And actually partners feel that way. You loved it more than you loved me.
And I know I've looked at some stats before, but it's something like, I think 17% of people in America in the past year have struggled with some kind of substance use. So it's really more common than I think we recognize in a lot of ways. And so I'm really glad that we were able to connect about this topic today. Dr. Jennifer, thank you so much for being here today. I really appreciate you coming on the show and talking about this 2 taboo topics in one. So thank you.
Right?
You're welcome. Thank you so much for tuning in to this episode of The Naked Connection. Be sure to subscribe so you don't miss another episode. Trust me on this, your sex life and that special someone in your life will thank you for it. And if you really love the show, please take a moment and leave a 5-star review or a written review and let me know what you think. It would mean so much to me and this show. Until next time, happy connecting.